Once the Commission delivers its report next week, what are your next immediate steps?
No, just asking Craig if he wanted to answer that one, but he's not on the Commission. The answer is that we have an interim report that is going to be released in 10 days. The statute for the legislation gave the Commission 2 years to look at this in a comprehensive manner. I guess I could turn the question over, if this is allowed, Donna, and see if Senator Landrieu might have some thoughts about, is that legal, or am I going to get yelled at? But the issue of some of the steps is honestly a congressional issue. So I don't, Senator?
Yes, and let me just thank Mark for his extraordinary leadership. As you can see, he is passionate and knowledgeable, and I think will make and bring the great energy necessary to move this through. And for Craig Fugate, who has warmed my heart and been very encouraging as he acknowledges that FEMA did make a lot of mistakes, and instead of protecting or covering things up, he's looking more squarely and clearly at what needs to be done. I would think that once this report comes out, our committee, which I chair the subcommittee, has already had one hearing. We could potentially have another to be broader in terms of looking at some of the issues that this report will show, and trying to move this legislation as quickly through as possible. It would help if there doesn't have to be a big financial number attached to this bill, although I believe in putting resources where they're necessary. But I agree with Mark Shriver that perhaps it's not really an issue of money, it's just an issue of organization and political will, and I'm hoping that we can provide that.
While you're here, okay. What steps would you like to see FEMA take to better prepare Louisiana and others for other states for hurricanes?
Well, that's a big question, and there are many things, but I would just stay on the subject that we're on here and want to reiterate a couple of points that the administrator made. First of all, I'm so happy to hear that he stressed the importance of getting schools up and open right after a disaster. We had 300,000 children, approximately, that had evacuated on Thursday or Friday, who thought they were going back to school on Monday or Tuesday. And when that Monday or Tuesday rolled around, instead of going back to school, it was becoming sort of clear to their parents that they may not be able to get back into the school that they left on Thursday or Friday for 6 months or a year or longer. There was no plan at the federal level to provide for tuition payments or reciprocal agreements where those children would go to school. It was because of Mark Shriver's uncle, Ted Kennedy, and Mike Enzi, and a few of us that got together and within 6 weeks wrote a brand new bill, basically sort of a tuition payment plan for 600,000 children to go to wherever they could get into a school, regardless of whether they came from a public school going to a Catholic school or a Catholic school going to a public school. Senator Kenney, in his great spirit, said, we just got to get them in school. Why? For two reasons. One, it does bring stability to their life, and they're back into a fairly familiar setting, even though it might be a different school or a different classroom. But most importantly, or as importantly as that, it helps their parents get about the business of rebuilding their homes and their communities. So I know I didn't answer the whole question because there are literally 100 things we need to do, but I wanted to take this time to reiterate the importance of schools and then also daycare, because it's not just school-age children, which we did pretty well with the school situation, but the daycare situation is as challenging, if not more so. The Small Business Administration does not lend money to nonprofits. They were very difficult to get money back into the community, to the nonprofit community for daycare, and until parents can get their kids stabilized, it's very difficult for them to start doing all the necessary rebuilding of their communities, particularly after a catastrophic disaster.
Thank you very much, Senator. If a hurricane or disaster struck tomorrow, what would be the immediate issues and the weaknesses for children?
Well, I guess to jump into and maybe answer specific things that the Commission would like to see passed, I think the issue of child care facilities across this country, as Senator Landrieu mentioned, is a big deal. If you have little kids, my wife and I, we have a 4-year-old, if that child is not able to go to childcare, is not able to get that support, we couldn't go back to work. It's that simple if your community is devastated. So it's a social justice issue, but it's also an economic development issue. I've been down into New Orleans, was there right after Katrina hit, and have been multiple times there since. And the fact that so many families have not gone back to that part of the country has to do in some small part with the fact that there isn't adequate child care across that region. So it's an economic development issue. Should we be providing resources to child care facilities before a disaster hits in order to mitigate a disaster? Should the Stafford Act or the federal government provide resources after a disaster hits? I think those are very important questions that need to be addressed. I think, as Craig mentioned, the training that emergency manager responders has in this country does not adequately take into account the needs of kids. So is the right equipment in those entities? Are the people that are manning those entities appropriately trained? Do they know how to deal with kids' issues? And I think the answer to that is no. We don't have the right resources from medical equipment to medicine, and the people are not trained in order to take care of kids. They're trained in many cases, as Craig has already said, to take care of adults. They're not trained, nor are our emergency facilities trained to take care of pediatric cases. So we really have to look at the training, the dollars that are granted out by the federal government for training, for purchasing of equipment, and also the child care issue, I think, is a very important one for long-term recovery. Because there are 3 phases of a disaster. There's the planning, there's the response, and then there is the long-term recovery. And I think we have not looked comprehensively at that still in this country.
And just one thing that I would add, which would not be done today, which needs to, is the mental health component of counseling a community after a catastrophic disaster. I mean, I try to explain, to people the difference between sort of your garden variety disaster, where a neighborhood in a community is destroyed, or a tornado moves through. As difficult as that is, and as tough as it is for the dozens of homes or even hundreds of homes that are destroyed, nothing quite prepares you for the destruction of an entire or metropolitan area or a large portion of it. It's just shocking to your fiber. It's shocking to adults. And for children, we've been cutting back on school nurses and school psychologists. I mean, there was a time in this country where most schools had a school nurse. Those days are long gone. We need to bring them back. After a catastrophic disaster, if we can't provide the mental health counseling for all the adults, which I think that we should, it's very costly in some ways, but it could be done in a much better and more cost-effective manner if we, as the administrator said, as children are clustered in schools, you could have some attention brought. There's significant issues in just regular life that people have to deal with, but as children watch their parents go through such anxiety and stress, think about it. They've lost their home, their job, their school, their church, their place of worship. Their neighbors are gone. Their family structure is gone. Everything that gives you a sense of who you are and what you're about after a catastrophic disaster. So these parents are pretty heroic, some single parents, trying to put those pieces back together. At least the schools and the daycare could provide some group counseling for children who need to not only understand what happened around them, but what's happening inside of their own families during this very difficult time. And I want to thank the Mental Health Coalition for trying to shine a little bit better light on this particular aspect.